Hello, this is Muhammed Yasir Demirci. I am a clinical pharmacy resident. In this presentation, I want to explain our clinical pharmacy service in COVID-19 pandemic. As a clinical pharmacy department, we are providing clinical pharmacy service to Marmara University Hospital, which has 685 beds. In addition to our program directors from Marmara University Faculty of Pharmacy, our team consists of 6 rotational clinical pharmacy residents who was providing clinical pharmacy service in different clinics of hospital at that time. This is our team. At the beginning of pandemic, some of us at the beginning and some of us at the ending of their 3-year clinical pharmacy residency program. In this difficult period of time, we were having discussions on our positions in hospital and decided to adapt our workflow to be able to continue our pharmacy practice service as far as possible. While we were discussing, our hospital became hospital only for pandemic, and only service we could able to provide pharmacy practice remained were COVID services. Then we decided to create remote working flow with minimum transmission risk and provide best service we can. As our pharmacy practice service is quite new, unfortunately we weren't have available system to be able to work in completely remote. But we adapted our workflow rapidly and we decided to create shifts which ensures available one clinical pharmacist in hospital every single day while others working remotely. While we were working on-site, we had 2 main tasks to do. First one is not very different from our everyday clinical practice, except minimizing transmission risk by avoiding living room unless it's very necessary, avoiding entering patient's room, making our recommendations to physicians by phone as much as we can. Second one was becoming middleman to helping our other colleagues to be able to do their everyday clinical practice remotely, which are getting information of their patients and making recommendations to providers. At the end of the day, this was our picture, continuing to our clinical practice and having lots of online meetings to optimize it. As we continuing to work in COVID era, we were continuing to observe medication administration in pandemic with clinical pharmacist perspective and tried to find solutions to drug-related problems in context of COVID-19 by reviving relevant and experienced organizations' guidelines and recommendations. Then we decided to compile these issues under several topics to create medication safety and medication management guide for healthcare providers in COVID-19, in addition to therapy algorithms and approaches of Ministry of Health and other local medical organizations. Our future plan is continue to become inseparable part of healthcare team, transform our clinical pharmacy service, publish our experience in COVID-19 era, design the thesis studies consist of COVID-19 patients, update and continue to create new guides. Before ending my presentation, I want to express our condolences to all pharmacists and healthcare workers who lost their life for service of people. Thank you.